Welcome back, everyone.
Today we're going to take a deep dive into something pretty cool, AI in healthcare, specifically a new framework called Voxel Prompt, which was developed by researchers over at MIT. And it is designed to analyze three-dimensional medical scans, things like your MRIs and CT scans, using like plain English instructions.
Yeah, and it's really fascinating because it has the potential to be like a huge game changer. Instead of relying on like a bunch of different AI tools for very specific tasks, imagine just having one AI that can do it all, like, measuring tumor growth or comparing scans over time, or even like answering these really complex questions about what it sees.
So it's almost like you have this like super smart AI radiologist like right there with you, analyzing your scans and giving you like clear, understandable answers, and all based on like, simple prompts. So what's the current problem that Voxel Prompt is trying to solve?
Yeah, so right now, AI tools that we have in radiology are often very specialized. So you might have like an AI that's amazing at like identifying tumors, but it can't really measure their volume. So then you'd need another AI for that. And it can be inefficient and make things really complicated for doctors.
It's like trying to assemble a piece of furniture, but you've got like, 12 different tools when all you really need is like a good multi-tool,
Exactly. And that's where Voxel Prompt comes in. It aims to be that like versatile multi-tool for medical imaging. You just give it a text prompt like measure how much this tumor has grown since the last scan, or is there any like abnormal contrast enhancement in this area? And it uses its AI smarts to analyze the three-dimensional scan and give you the answer.
That's incredible. So how does this thing actually work? Is it like magic or something?
Well, not magic, but it's pretty close. So Voxel Prompt combines three key AI components. The first one is the language model. Think of this as like the brain of the system. It understands your instructions and figures out what steps are needed to analyze the scan.
Okay, so it kind of gets what you're asking it to do. So what happens next?
All right, so then there's the image encoder. And this component basically extracts all of the important features from the three-dimensional scan, and it turns that really complex image data into something that the AI can actually understand. It's like translating a foreign language into one the AI can speak.
So it's kind of like making sense of all of that visual information.
Okay.
And what about the third component?
Yeah, so the third piece of the puzzle here is the image generator, and this allows Voxel Prompt to actually create new images based on its analysis. For example, it can highlight specific areas of interest or even generate a three-dimensional model of a tumor.
Wow, so it's not just analyzing the scan, it's also creating visuals to kind of help us understand what it's seeing. That's amazing.
Yeah.
It sounds like this technology could have like a really huge impact on how doctors analyze medical images.
Absolutely. And to test its capabilities, the researchers at MIT actually threw a bunch of different brain imaging tasks at Voxel Prompt. They wanted to see how well it could segment different brain structures, measure tumor volume, compare different regions of the brain, track changes over time, and even answer really complex questions about the images.
It sounds like they put it through a real obstacle course of medical imaging challenges. How did it do?
So it performed remarkably well in a lot of cases. It was like just as accurate as specialized AI models that are designed for like, those very specific tasks. For instance, when it came to like segmenting brain structures, it actually outperformed a state-of-the-art tool called SynthSeg.
Wait, hold on. Are you telling me that this one AI can do the job of multiple specialized tools and sometimes even better? That's a pretty big deal. What makes Voxel Prompt's approach so unique?
Yeah, one of the like really key innovations here is this idea of grounded analysis. So unlike some AI models that might just like give you an answer based on like patterns in the data, Voxel Prompt actually like shows you how it got to that answer. It breaks the analysis down into these like concrete image processing steps, making it more transparent and reliable.
No, so it's not just like this black box spitting out results. You can actually see like the logic behind its decisions, which seems really crucial in healthcare, where you need to be able to like trust the technology,
Exactly. Imagine asking Voxel Prompt to measure a tumor. It wouldn't just give you a number. It could also like show you exactly how it segmented the tumor from the surrounding tissue, like the area and measured any calculations it performed. All that transparency really builds trust and helps doctors understand how Voxel Prompt is working.
So that makes a lot of sense. Now, earlier you mentioned one of the cool things about Voxel Prompt is that, like its flexibility. You can interact with it using like, natural language prompts. How does that translate into like real world benefits for doctors?
Yeah, so think about like traditional interactive segmentation tools. They often rely on things like bounding boxes or clicks, which can be pretty cumbersome and, less precise, especially when you're dealing with these like complex three-dimensional structures.
It's like trying to paint a detailed portrait, but all you have is like this giant paint roller. You need like a finer tools for that kind of precision.
Exactly. And Voxel Prompt, with its natural language understanding, it provides those finer tools. Doctors can use like familiar medical terminology to pinpoint exactly what they want to analyze. They could ask Voxel Prompt to like isolate the hyperintensities in the left hemisphere or measure the volume of the ventricle. It's about harnessing the power of language to guide this complex analysis.
So it's almost like having a conversation with the AI, giving it like specific instructions using the nuance and precision of human language.
Precisely. And that level of interaction really opens up a ton of possibilities. For example, if a patient has like multiple lesions or abnormalities, a doctor could ask Voxel Prompt to like segment only the lesions that show contrast enhancement or analyze the area of edema surrounding this specific lesion.
That's incredible. It sounds like Voxel Prompt could like significantly streamline the entire process of analyzing medical images. And it's not just limited to like single scans, right? It can also handle multiple scans from the same patient.
You're absolutely right. Voxel Prompt can analyze scans taken over time, which allows doctors to track changes and monitor disease progression, for example. It could be used to measure tumor growth or track the expansion of ventricles in a patient with encephalitis or observe how the signal changes in a stroke patient.
So it's giving doctors like a more comprehensive view of the patient's condition over time, which is super important for making informed treatment decisions. Now, the researchers were really thorough in evaluating how well Voxel Prompt performs. How did it stack up against other methods?
Yeah, so they compared it to both specialized AI models and a state-of-the-art method called SynthSeg. And what's really remarkable is that Voxel Prompt held its own. It demonstrated comparable accuracy across a really wide range of tasks. In some cases, it even outperformed the specialized models, which really highlights its impressive versatility.
That's really impressive. It seems like Voxel Prompt has the potential to be like a real game changer in radiology. But like any new technology, it must have some limitations. What are some of the challenges the researchers acknowledge?
Yeah, so one primary limitation is that currently Voxel Prompt is mainly trained on brain imaging data. So while it excels in neuroimaging, it might not be ready to tackle other types of scans just yet, like chest x-rays or abdominal CT scans.
So it's a bit of a specialist right now, but with the potential to become more of a generalist in the future.
Exactly. And the researchers are already looking ahead. They're envisioning a future where Voxel Prompt is trained on a much larger and more diverse data set, encompassing a wider range of medical specialties.
That makes sense. Expanding its knowledge base would allow it to become like a truly universal medical imaging tool. Now, I'm curious about something else. The paper mentioned that Voxel Prompt could potentially interact with other systems like medical databases or even on the scanner guidance systems. That sounds pretty futuristic.
It is. Imagine Voxel Prompt being able to access a patient's entire medical history, comparing their current scan to previous ones, and even factoring in relevant lab results. It could provide a much more holistic and personalized analysis.
It's like connecting all the dots, bringing together all of these different pieces of information to paint a more complete picture of the patient's health.
And beyond that, think about the potential for real-time guidance during procedures. Imagine Voxel Prompt integrated with a scanner, helping doctors navigate complex anatomies during biopsies or providing real-time feedback during surgery.
Wow, it's like having an AI co-pilot in the operating room, offering expert insights and guidance. It's amazing. We've covered a lot of ground here, from the technical details of how Voxel Prompt works to its potential applications and limitations. But let's zoom out a bit and talk about the bigger picture. What are the broader implications of this technology for the future of healthcare? It feels like we're kind of on the cusp of this big paradigm shift in healthcare, with AI playing a bigger and bigger role.
Yeah.
And what kind of impact could a tool like Voxel Prompt have on the field as a whole?
Yeah, I think Voxel Prompt really embodies this exciting convergence of AI and healthcare, and its implications kind of touch upon some really critical aspects like, accessibility and efficiency and ultimately, patient care.
Yeah, let's break those down one by one. You mentioned accessibility. So how could Voxel Prompt make advanced medical image analysis more accessible to more people?
Right now, the ability to interpret these really complex medical images is often concentrated in specialized radiology departments. Voxel Prompt could help to kind of democratize that expertise and make it available in a wider variety of healthcare settings.
So even in areas where there might not be easy access to specialized radiologists, doctors could use Voxel Prompt to get these insights from medical images, which could lead to earlier diagnoses and like timelier interventions.
Absolutely. Think about like rural communities or remote areas or even like developing countries. Access to specialists can be like a huge challenge in those settings. And Voxel Prompt could help bridge that gap and empower those healthcare providers with a really powerful tool to help them diagnose and plan treatments.
It's almost like leveling the playing field in a way and ensuring that like geography or limited resources don't become these barriers to quality healthcare. That's a really powerful idea. What about efficiency? How could Voxel Prompt improve efficiency in radiology?
Well, radiology departments are often dealing with just like a huge volume of medical images that need to be analyzed. It's like this constant flow of information coming in.
It's like drinking from a fire hose, trying to catch every little detail.
Exactly, and that's where Voxel Prompt could be like a huge asset. You know, it could automate a lot of the routine tasks that are involved in image analysis, things like segmenting structures or measuring volumes, and even providing like preliminary characterizations of what it's seeing.
So it's almost like having like an AI assistant that kind of pre-screens the images, flags any potential issues, and prioritizes the cases that need a radiologist's expert review.
Yeah, that's a great way to put it. And by taking on some of those like routine tasks, it could free up radiologists to focus on those like really complex cases, which could lead to faster turnaround times and potentially, even reduce costs.
It sounds like a win-win for like both the doctors and the patients, of course. Like the ultimate goal here is improving patient care. What are some of the ways that Voxel Prompt could like directly impact that?
I think the most immediate benefit would be, earlier and more accurate diagnoses by giving healthcare providers a really powerful tool for image analysis. Voxel Prompt could help to detect these really subtle abnormalities that might be missed by the human eye, and catching those diseases in their earlier stages often means that the treatment is a lot more effective.
It's like having like a second set of incredibly precise eyes scanning those images just to make sure that nothing important is overlooked.
Exactly. And beyond diagnosis, Voxel Prompt's ability to track changes over time can play a really crucial role in monitoring like how well a treatment is working. Being able to precisely measure something like tumor shrinkage, for example, would give doctors really valuable insights into how a patient is responding to a therapy.
So it's about creating a more personalized approach to treatment, tailoring it to the individual patient's needs and how they're responding.
Precisely. And as Voxel Prompt continues to evolve, incorporating more data and integrating with other systems, its potential to personalize healthcare will only grow. Imagine a future where it can access a patient's entire medical history, their genetic information, lifestyle data, and use all of that to provide really individualized risk assessments, early warnings for potential health issues, and even recommendations for preventive measures.
It's like having a personalized health guardian constantly analyzing data, looking for patterns, and giving both patients and doctors insights that empower them to make the best decisions.
That's a great analogy, of course. With any new technology, especially in healthcare, it's crucial to move forward thoughtfully and responsibly.
Absolutely. We need to make sure that AI is being used ethically and effectively to enhance, not replace, the expertise and judgment of healthcare professionals.
I completely agree. As we kind of enter this new and exciting era of AI in healthcare, I think it's crucial for everyone to stay informed, engage in these important conversations, and advocate for the responsible development and deployment of these technologies.
Yeah.
Ultimately, the goal is to use AI to improve patient well-being.
Well said. So as we wrap up this deep dive into Voxel Prompt, we leave you with this question. What role do you envision AI playing in your own healthcare journey? Think about it, talk about it, and let's work together to shape a future of healthcare that benefits everyone.